बिस्मिल्लाहिर्रहमानिर्रहीम। इय्याका नअबुदु व इय्याका नस्तईन। अल्लाहुम्मा सल्लि अला मुहम्मदिन व अला आलि मुहम्मदिन व बारिक सल्लि व सल्लि अलैहि। Dear colleagues, I am Dr. Sultan Ayub, working as a radiologist. This is female 50-year-old patient with history of heavy menstrual bleeding, and during the bleeding, during the menses, she feels intense pain within the pelvic region as well as in the right side of the abdomen. From the last 4 months, she is feeling significant heaviness of the right side of the abdomen, and also the intensity has increased for the last 4 months during the menstrual cycle. In between the cycle, she doesn't feel any pain. So I am scanning the uterus of the patient directly.
Nothing.
Here we can appreciate this is the uterus of the and here if we closely observe, this uterus is heterogeneous
सही है.
and myometrium anterior and posterior is bulky. This is the endometrium, and here we can appreciate the echogenic foci scattered within the posterior as well as the anterior myometrium. So this is likely the case of adenomyosis of the uterus. Look at the echotexture of the uterus. These echogenic foci represent the endometrial gland. However, the endometrium is not endometrium is clearly visible. It is not indistinct. So this was the case of adenomyosis of the uterus. Now we see what is the cause of pain in the right side of the abdomen. This is the ovary, this is the left, both are looking normal. This is the uribladder. So now I am going to right side of the abdomen. This is the right side of the abdomen. Here we can appreciate this is the omentum and this is the gas filled bowel loops. The omentum is heterogeneous and we can appreciate the hypoechoic nodules. This is the nodule, this is the nodule, this one, and relatively the omentum is hypoechoic. Also, it is thick, significantly enlarged. This is the omentum. Now I am going to see it in rear. Look here, this is the nodule, this is the nodule, and this is the omentum, this one. So we have seen that the omentum is heterogeneous, hypoechoic, contains multiple hypoechoic nodules. And I have seen the other abdominal structures. No such findings are seen. Patient is not having any ascites. Only she feels heaviness and the pain, cyclic pain on the right side of the abdomen. So it is likely, it is likely the case of omental endometriosis as well as the adenomyosis of the uterus. This lady is getting treatment from different doctors, but she is not getting relieved. So here we can appreciate this is the adenomyosis of the uterus, and then there is the extra pelvic involvement of the endometriosis involving diffusely the omentum, greater omentum of the abdomen, which has appearance of heterogeneity, increased thickness, hypoechoic. So in conclusion, this is the case of adenomyosis of the uterus with extra pelvic involvement, omental endometriosis. Thank you very much.